Hello and welcome to our book club series where we are talking about Nourishing Wisdom by Mark David. And today we are going through chapter 13, The Psychobiology of Chewing, which is so fun. And I'm excited because we have Leah Hackney with us today to go over this topic. So let me introduce you to her really quick and then we'll dive in.
Sounds good.
So, yeah. Oh, I'm like managing a bunch of windows. Hold on. Okay. So Leah Hackney is a registered dietitian and a certified specialist in pediatric nutrition. She works with families who have kids starting from infants to teens. She helps families raise intuitive eaters, heal their relationship with food, and find fulfilling, sustainable behavior change. Her approach is all weight inclusive with a help at every size lens. So perfect. I'm so excited to talk about this with you. And Leah, if you don't mind, go ahead and share with us your own kind of journey or story with food and body and where you've come from and what has brought you here today and what you do now.
That's a really good question. So I probably started becoming more aware of what I was eating around the high school age, which I know is pretty common for a lot of people. You start seeing your bodies change going through puberty. For me, it actually started with a World Vision video on malnutrition in third world countries and developing countries. And that really just intrigued me as to, how the social impact of food affects people, access to food, affecting people, poverty, malnutrition, things like that just really got me interested in it. So I actually ended up taking one of those kind of online career quizzes, and it actually said I was either, for lack of a better word, destined to be either a nurse or a dietitian, or somewhere in the medical profession. And so when I applied for university, that was my focus. And I would say around that time, I have moments in childhood where, because I have an intuitive eating lens now, I can look back and say I was an intuitive eater at certain parts of my childhood. High school, things get a little bit kind of blurry where, you have people making comments about your body, your body is changing. And in that sense, I did go through a time where I was very, very restrictive around food. And then going into university where you're choosing to learn about a subject around food, all your classes are nutrition, you're studying nutrition, you're eating nutrition, you're thinking about nutrition. I mean, you're essentially, your whole life is kind of just thrown into this world. And so that was probably where my habits around food became the most disordered. And it was in combination with the social impact that I had, or not the social impact, but the like societal impact on me, I guess would be a better phrase. It was, and it's not to blame the people I was around, but the people I was around were very conscious of their bodies. They were dieting constantly. I was at a university that had conventionally very attractive, thin, beautiful, smart, intelligent women. And it was just, I was in a major where it was like majority of women were in this major, my nutrition major. And it was just like this competition almost. And then you're learning about food and you're learning actually about diets. So then you're trying them,
Right.
You're like, okay, well, one day I'm going to be possibly teaching this to someone. So I need to learn how to try this, so you're trying all these different diets. So it was like at that time, I probably went through almost everything you could think of, where I was tracking things, counting carbs, counting this, monitoring sodium, it was like, I switched between food journals, I switched between everything else. And then at this time too, I was compensating with exercise, that mindset of calories in, calories out. I was kind of like, I was studying it. And I was like, okay, well, I know how many calories I need in a day. So I have to like burn that many calories, right? Or I have to burn X amount of calories, or it was all those calculations. And it wasn't until I started working professionally where I was like, hold up. If I do this, and I'm happy with where my body is at right now, I achieved a certain status with my body that I was acceptable with, but it was almost at what cost?
Mm.
And I was looking at it like, if I want to stay here, I have to keep doing all of that other stuff. And it was costing me too much. It was costing me, social outings, relationships with other people. It was costing me relationships with myself, relationships with food,
Right.
where it was just, and I was seeing these people kind of spiral in it. And it was, people around me were getting diagnosed with eating disorders, and they were going and to, they were in treatment and they were in recovery. And I was kind of like, whoa, like, what if that could be me? And so you're kind of flirting with that idea. And really it wasn't until I was working professionally that I found intuitive eating from another dietitian, thankfully. And at first I was like, it's another diet. It is another diet. And then I was reading it, and it's, to be honest, it's kind of a hard book to get through. It, in a lot of different ways, because it does make you really reset yourself in some ways. It's also technical. It's very technical jargon, very nutrition heavy jargon. It's kind of a thick book. And then it also covers so many different subjects. There's 10 principles. So it's almost overwhelming where you're like, okay, so then I want to be an intuitive eater, so I have to follow 10 principles. And it was like, that almost was really hard for me to grasp as well. And then it was finally until I just started, I don't know when it was in my life where I was like, I think I'm just kind of fed up with all of this, because, I think it was more of the body acceptance movement, some of those kind of movements where I was like, you know what, I need to start appreciating my body, appreciating what it does. I was working at hospitals. I was seeing people who were sick, seeing people who were ill, seeing people whose conditions had nothing to do with their size. And, it was going to be affecting their quality of life for the rest of their life. And I've seen people of all sizes getting diagnosed with certain diseases. So I was like, I can't attribute anything specifically to weight or size, because it wasn't real. It wasn't true. It wasn't fair to those people who were the exceptions. I was seeing people in larger bodies getting diagnosed with conditions and diseases that are typically associated with people in thinner bodies. I was seeing people in thinner bodies, straight-sized bodies, that were getting diagnosed with things that were typically found research-wise in larger bodies. And so it was kind of like, I kind of had to toss all that out the window. And I think a little bit of that, I also tossed a little bit of my own misconceptions, understandings around health, wellness, out the window as well. And I was like, you know what I know is I am a better person when I move my body. I'm better at my job. I'm better mentally with my focus. I'm better at my emotions when I move my body. Where can I give myself like more permission? So I was like, okay, I'm going to give myself some permission around food. That was really difficult. I'm not going to lie. And there's still some things that I even was like concepts. Like I was even talking with my partner, my husband, on the car on the way here around, even like, for instance, soda. I was always taught like soda is the devil. It's, you could put it in your toilet and it can clean your toilet, things like that. And it was like, it hasn't been until I've reached whole, like little foundations of trust, where I regained trust with myself, to where I was like, I looked at him, because yesterday we went out to eat and he ordered like a regular Dr. Pepper, just a regular can. And I was like, yeah, I'm going to have some of that. And it was like, I wasn't tracking the calories. I wasn't doing that. But I don't think until I didn't just arrive at that moment. It was continuous foundations of trust that I had to rebuild with myself. So every time I rebuilt those trust, even if it was around an entirely different food, I rebuilt that trust with myself. I rebuilt, what felt good with my body, and what felt good with movement, what felt good with my quality of life that I was searching for as an individual. And that's kind of where I got to the point where I was in the car like, yeah, that sounds good. And I think that's kind of the win that everyone's looking for. It's not always going to happen in a day, and it's not going to happen, mine happened over years. It's not always going to happen even over years. And I'm not even saying that I'm fully out of that dieting mindset, because it still sneaks back in and I still have bias and I still have times where I'm like, oh, but for me, like when I can wrap my head around certain concepts that previously I really demonized, I think that was kind of where my journey, I was like, okay, I think I'm doing something okay if I'm getting to this better place with myself.
Yeah.
So that's a little bit about my journey.
Yeah. Thank you. No, I can identify with a lot of that for sure. Really interesting though, the idea that what interested you was like this global crisis of nutrition, and you're like, oh, I'm gonna learn more about that. I've never heard that before, so that's really cool.
Yeah.
And it just goes to show though how it's not just a nature versus nurture thing, right? Like it could be one thing that one teacher said or one friend or like, and this is what I'm really excited to talk with you about today, especially with how you help parents and children in developing, healthy relationships with food and how to be intuitive eaters, right? Is even as parents ourselves, knowing what we do know, trying to inoculate our own children, still it's scary knowing that they could pick up on it anywhere because it's everywhere, right?
Yeah.
And I'm like you too in that. I mean, I grew up with it, but it probably didn't really get as bad as it did until college because of the classes I took and the professors I had and the roommates and the colleagues and everything, that it just is like I was steeping in that for so long that it just kind of, I took it on as my own truth, right?
Yeah.
So it's just, so I guess my first question for you, which has nothing to do with the book, but what would you say for anyone really, especially, I guess, parents, how do you kind of combat that onslaught? Like what do you do to kind of keep yourself firmly grounded in that ability to trust yourself when everyone and everything else is telling you that that's not possible? What would you recommend that people do to kind of stay okay,
That is such a good question. And when you started talking about this, I immediately was thinking of, think of I love her, Dr. Maria Paredes with This Body.
Yes.
Her grounding techniques. She does that Instagram where it's like the grounding Sundays. There are always going to be onslaughts of things that are going to come at you, and it's going to be the least expected, and it's going to be from people you admire. It's going to be from people you care about. You're going to want, different things for them. I would say like some kind of grounding technique, whether it is an affirmation with yourself, whether it is a grounding technique, like literally in plating yourself, in their food preparation, in purchasing the food, however you're getting it from, like we, like my husband and I were just watching The Final Table on Netflix, and it's a chef kind of cook. Like it's a chef. I don't want to say cook off because they're Michelin star chefs. So it's like chefs creating these Michelin star plates, and the way they use the language around food, they call it intelligent, creative, an idea. They call it, all this kind of language. So I would say, in addition to whatever grounding technique you use, changing your language is the only thing you have control over. You don't have control over what's coming at you. You have control over changing your language and your internal dialogue around food. And if you're coming up with that, oh, that's a bad food, that's a, for me, it was soda. That food you could put in your toilet and you could clean it. And you know what? I'm like, yeah, you probably could, but you could probably also do that with lemon juice. You could probably also do that with lime juice. You could probably also do that with, some smoothie or something.
Or apple cider vinegar or
vinegar. Yeah. And so I kind of had to counteract those thoughts with like, where is that coming from? Where was that origin? What is it? And then the biggest question that I think has helped me change my focus is it serving me? Is that idea serving me? Is this language serving me? Is it serving me and getting me to the place and the person that I want to be? So I think that shift, and that's not something that takes a lot of introspection.
Yeah, it does.
and it really does take to be introspective. So there are some people who are not quite ready to have that level of introspection with themselves because there's a lot of trauma. There's a lot of barriers there. But you can still not even have a level of introspection and still change your language and just use different words. And it sounds silly, but it's like, he even mentions it in the book, in the chapter, like the good, bad foods, it's that moralizing around something that is not human. We don't moralize a chair that doesn't serve us. You know what I mean? We don't moralize our, I'm trying to even think about it, a car that doesn't work. People can get angry at the situation, but like, it has a function. It is an inanimate object. This, food is chemicals combined together that nourish us. So in that sense, I hope I answered your question, because it's still like, that's an amazing question. And it's almost like something I'm kind of constantly like daily struggling with coming up with an answer for.
Yeah. Well, it is a hard question too, because it will depend on the person, right? Just like eating does. Your body, your choice, your experience. But I love that. I think those are really great suggestions for sure. To just be mindful of the language that you're using in your food. And even, I'll have to watch that show, because I love the words that they're using. That sounds awesome. But even just like neutralizing the conversation, right?
Yeah.
Just, instead of like, this is a good apple, it's just like, it's an apple. That's it. Like, if we just took out the labels and the descriptors and just called it what it was, neutralize it. But I would say, to add to that, and getting in like in your body, right? And using that as a grounding for sure. Again, depending on where people are at, you would probably want to consider therapy, right? Or a trusted friend that has that kind of neutral language, so you can interact with them, especially as women. We tend to kind of bond over body shaming or food shaming. So I think it's really important to develop relationships that has neutral conversations when it comes to food and body, and make sure you're having neutral conversations in here as well. But I think this is why I read books like this. This is why I, listen to certain podcasts, or heck, this is why I do what I do. Honestly, it's to help keep me invested and immersed within this culture, I guess, so that I can kind of counteract diet or wellness culture, right? And especially within the walls of your home, like, you really can kind of create that safer atmosphere, so that when you do send your kids out, they can come home saying, hey, I heard this at school. Is that true? And you can have a conversation about it. So
good.
Yeah.
And I love what you say about that too. If I may interject, there's kind of an example of the kiddos I care for. They have learned either through play school or through somewhere. It's not necessarily from me. They were asking, she was pointing at foods and said, is this good for me? 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 And she wasn't saying, is anything bad for me? But still, even when we use that, is this good for me? It still indicates that there's something bad.
Right.
So sometimes even when you're using language where you're still like, oh, I'm only using positive language, I'm only ever speaking positively. I'm only ever speaking positively around certain foods. That absence of that, using that language still has that absence to fill in that negative and, the opposite of it, essentially. So it was really interesting. At that point, I still just kind of had to keep repeating, all food is good for us. All food, nourishes us, and just kind of kept trying to say, like, all food helps us, helps our bodies. She's 5, so sometimes it sticks, sometimes it doesn't. Sometimes things stick and I'm like, yes, like, you remember it. And then there are other times where it's like, okay, we'll work on it.
Yeah, no, you're right. because I think it's just our human nature to kind of create those false dichotomies. Yeah.
Absolutely.
And it's kind of, I mean, that's kind of how it was for me. Even using words like healthy, I can't use I can't use that anymore. And my kids will ask, like, is this healthy for you? And I have to say, well, it's supportive, or it depends on why you're eating it or what you're needing, or, you know, like I have to clarify, because especially in our society nowadays, like where health is this, you know, it's either you're losing weight or you're trying to be healthy, right?
Yeah.
And so like healthy now means something. It's not just, do you feel good? Can you function well? Or, you know, it's like I'm a better person because I'm healthy kind of a thing, right?
Yeah.
So I've had to stop using the words healthy or unhealthy, because that was so drilled into me in school, you know, that that it's like I can't, now it's more of, it's the word I'm choosing to use is like, is this supportive for what I need now versus unsupportive? But not that just because it's unsupportive means that I can't also eat it. It doesn't mean that it doesn't have a place on my plate. You know, it's just it's hard.
And language is hard in that way too. Like the way we're wired is really difficult. And I actually was thinking about that too, because since being more, you know, diving into health at every size, intuitive eating, healthy also feels the same way to me. And I remember seeing something online about kind of some dietitians and some practitioners, health practitioners, consultants, on also wanting to like almost reclaim the word healthy.
Yeah.
Because it does get wrapped into that wellness diet and that healthism. Yeah.
I think too, I guess this is a little off tangent, and we're going to get into the book, I promise. I guess I'm just thinking about children, and, you know, because you're born an intuitive eater.
Yes.
You are. And, you know, you cry and you're fed, unless there's horrible living situations. But we're going to say for most people, you know, their needs are met. And that's not, but I'm trying to like imagine at what age do children start like picking up on cues of, oh, that's bad for me and maybe I'm bad? I know that I've heard somewhere like around the age of 8, kids are able to actually conceptualize or understand symbolism, you know, so food can actually turn into a meaning of something. But I'm wondering, even at 5, like your client, right? It's where does it start? You know, is it like they're safe until they're 2, or when did it start picking that up? And it's, where is it coming from? Is it coming from you and your relationship with food, or is it in the shows you're watching, or like?
That's such a good question.
When did it start, and where does it come from?
Yeah. Oh my gosh, I'm so glad you asked this, because I have been thinking about this, and part of my answer is going to be, I wish I had more research based, because I always like to be a little bit more evidence based, just because there's always someone who's going to be like, that's not true. So I'm going to claim this as my professional experience with people. Around 2 years old, I've noticed people and kiddos start recognizing when something is being restricted or not. So the concept of, no, you've had too much, or something like that kind of concept I've seen around like 2.5, they're able to kind of like, they don't quite grasp the full concept, but they're able to understand that there is restriction involved. So whether that is restriction in like food insecurity, food access, or whether that is like parents physically saying like, no, you've had too much, because they're also grasping that word no, and they're also trying to kind of reclaim it for themselves, because that's when they're starting to express that more body autonomy, and they're starting to like a lot of 2-year-olds really claim the word no. And so I would say it's probably even earlier than 8 years old, in which what I'm seeing.
I'm sure.
Yeah. And in that sense, you know, what you asked about, sorry, I think you asked about, you know, at what age they are, my mind just kind of.
I don't remember. I think the question was, if I was to like, you know, rewind. it's maybe around 8, that's when they can start moralizing food.
Moralizing. Okay.
But you're right in that, like, as early as toddlerhood, when they're really experiencing or wanting to experience that autonomy,
yeah,
certainly pick up on those restrictive cues for sure.
Yeah. And I would say the moralizing happens before 8 years old. And really it happens as soon as language is developed.
Right.
You know, and it depends on the language development of the kiddo. It depends on, you know, where they fall. But yeah, I would say it probably happens then. And it does happen the most probably with immediate caretakers, caregivers, family. And then I would also say any other secondary authority. So whether that is like nanny, caregiver, distant family member, and or teachers. And then I would also say that's also where they're getting exposed to peers, right? So you're having kind of this combination, almost like a preschool, play school type environment, where they're now loving to insert information on health and information on food and things like that. And so, you know, they're doing these exercises and they're doing things in their head. They're like, well, they're going to have a healthy relationship. They're going to choose healthy foods. But we also don't get to decide what their food preferences are yet. We don't also get to decide what is healthy for them yet, because certain people, certain foods, even foods that classically fall under a quote unquote healthy category. I don't like using that, but for the sake of this, we'll use it, you know. Some people do not tolerate very well, and kids might not even have the ability to express that. They might just show symptoms, or they might, you know, show discomfort or something like that. So yeah, it's happening earlier than we think.
Yeah, no, you're right. I didn't even like really realize. Yeah, 2 babies. But you're right.
Really are babies.
I remember, and you hear it too all the time, of like, how do kids even know that like candy is good? Like, even if they've never had access to candy, they're like, I want that. How do they know? Well,
if you've been restricting it,
if it's not available, then they're gonna want it, right?
Yeah.
Let alone the whole like pretty packaging and everything else, right?
Yeah.
That's crazy.
Yeah.
It's like secondary subliminal messaging that they're picking up on through their caregivers.
Absolutely. Absolutely.
All right. Well, I have lots of other. Let's jump in. I have lots of other questions, but I do want to jump into this.
Yeah.
So, that being said, one of the reasons why I wanted to talk with you about this chapter about chewing is because chewing is a developmentally appropriate trait, which is when is that actually appropriate? When does that start? When are people actually able to masticate and chew their food?
Around, so, okay, this is, I guess, you can masticate, maybe not with like grinding, like the way with like teeth. So yeah, with so I guess I call it gumming because you see babies gumming at like 6 months old.
Yeah.
I've seen them even doing it at 4 months, where they're reaching for something, putting it in their mouth, you know, and they're gumming it, you know, and it's not like a bottle, or it's not a breast or anything like that. Like it's literally just they're picking up a book, or they're picking up anything and they'll put it in their mouth. So 4 to 6 months, definitely usually around 6 months, depending on if the kiddo was, you know, a term baby, developmentally appropriate, they will be showing that indication. And, you know, you can give them something, you know, we know with baby-led weaning and baby-led feeding, I think I've talked to you a little bit about that. You know, you can give them something like, you know, egg or an avocado or something that's smushy, where, you know, if you were to take your tongue and like push it on the roof of your mouth, it would smush. And so you're also looking to see if they, you know, if they can do that kind of, you know, they're not, they're developmentally appropriate, but really at 6 months, I've seen them take something, you know, out of my hand and just, you know, smush it. And like, you know, they're still figuring it out. It kind of drools out of their mouth, but like, I mean, they're grinding and smushing and, you know, making that making that motion to eat.
So that's really interesting because, well, I don't know how old your kids are, and I don't know how old the kids are that you actually work with, but my oldest is almost 14 and my youngest is 7. So it's been a long time since I've been like a baby, right? But I remember things have changed a lot over the years, of like even what foods are appropriate to introduce now and when to introduce them. So what is the difference between like the tongue thrust and having the like motor skills necessary to actually eat their food versus exploring their world through oral stimulation or whatever you want to call it?
Usually it kind of it goes hand in hand with being like allowing the kid to be exposed to food. So at some point, it always starts with oral exploration or oral development, sensory development. It will always start there. At some point, it is up to the caregiver or caretaker to really use that as a vehicle and as a way to introduce food. So when they're grabbing something and putting it in their mouth, that is when now typically, we're encouraging families to say, okay, developmentally appropriate, age appropriate, safe foods, feel free to let them pick up or you can hand it to them depending on, what your level of comfort is. You can hand it to them and have them pick it up from you. You can preload like a little, spoon or something and give it to them. Or you can actually spoon feed them. It depends on, every family is different, depends on culture, depends on access, whatever you're available to and comfortable with. So in that sense, it will start with the development and then you'll work your way towards just saying, okay, around 6 months, this is kind of when I'm going to be introducing food. If family or caretakers are scared, then sometimes I see it, 7, 8 months, and I'm kind of at that age, by a year, we're wanting them to have like a really solid variety of combination age appropriate foods that are more on the solid end. And we're starting to kind of work on weaning away from that liquid diet. But it does depend on the culture, because in some countries where food is limited and the access is limited, breastfeeding and breast milk is like primary nutrition for 2-3 years. And that is totally age appropriate. Other countries where food is in abundance, families are usually wanting to get that progression, that development down, for lifestyle scheduling, for, caretaker parent situations, things like that. And also just for the development of the child. I hope I answered your question.
Yeah, no, it's just so interesting to me. And I guess it just goes to show, one thing it goes to show is that food recommendations change from literally from when you're a baby to an adult. So it's just really interesting to me that, years ago it would never be like, oh, start with a carrot, or, well, I don't know.
Like steam a carrot and give it to them, and cut it in a certain way and give it to them, and it's age appropriate.
Like that blows my mind. It's like, no, it was baby food.
And
you started with rice cereal.
Yes, rice cereal or oatmeal or something, and then you work your way up. And it's that sense too is a little bit of kind of a cultural dynamic. And it's also, the Western development of even the food system has a play in that as well. So you're looking at the book, I think I had mentioned to you previously, Born to Eat. So good. You should definitely read that book. That book is super fun to read. And it mentions, like, I think in the 50s, there was just kind of this development of the food system where packaging and preserving food really became prominent. And it really, you're revolutionizing the way things are staying in a grocery store. You're transitioning from that, like produce and products that spoil quickly versus ones that can last on a shelf for months, years, and that exploded out of kind of the Depression era.
Right.
So, you're having these people who remember that Depression era, and they're like, this is incredible. I can have cans of things instead of just cans. I can literally go to the store and buy little cups, peel away cups of baby food, jars of baby food, things like that.
Mm-hmm.
And so, and it worked with the scheduling, and it worked with the way the culture was then. And people carry culture as long as it works, and as long as people don't question it.
Yeah.
they'll carry it.
Lasts for a while.
They'll carry it, until someone really works to disprove it or works to do something else. And there's nothing wrong with solids or with introducing solids with purees. There's nothing wrong with that. I think the one thing that I can say as a dietitian now with intuitive eating is I like to see kids preserve their intuitive eating throughout the whole process. So whatever you choose, preserving that intuitive eating in the best way you can, with being reasonable with yourself. So even if you're using that steamed carrot that's cut in a certain way, you could put it on something, or you can, whatever vehicle you're using that works for your family, you can do that. Or if you're using purees, you're having them you're helping them lean into it. So the child is initiating, yes, I am hungry. And then when they're not, you're like, oh, okay. They're pulling back, they're turning their head. You're able to recognize those cues even without language. It's pretty cool.
Yeah, you're right. Because they're able to, just by watching their body language, say like, I'm done, or I'm interested, or yeah. And wouldn't it be so fascinating if as adults we gave ourselves permission to do that as well?
Yeah.
Instead of like, oh no, I gotta eat everything on my plate.
Yeah, I know.
Okay, let's jump in. I know we've been talking for like 40 minutes, which is great because it's all good stuff. And we haven't even gone into the whole like food allergies and introducing those when you're young. So
yeah.
Questions about how to feed your kids and just talk. Okay. So with all that being said, what was your favorite part about this chapter, and as it relates to the importance of chewing?
This, I think it's hard because I do really like this. I liked that study, and it's very like an aggressive study when it's like, but the study with the rats, it's like it really stood out to me, where I think on page 157 it says, in one fascinating experiment, scientists deprived a group of test rats of taste sensation. Both this group and a control group were placed on normal rat diets, and in a short time the taste deprived rats all died. Whoa. So, and like, obviously humans are different than rats, but we do use rats commonly in studies. And it's so interesting too, because this is the section at the end of that paragraph with talking about patients with being fed intravenously or tube feeding. This is what I saw in the hospital, in my clinical experience, probably largely in my career, always. And there is a lacking there, that these people that either have never been able to eat by mouth, have always been having to feed, either through a tube in their stomach or through their like intravenously. And there's atrophy. There's a lacking there. There's they do kind of yearn for something, a fixation in their mouth. And that's also, that is assuming that they're cognitively aware to have that understanding that is something that they're wanting, and that they're cognitively aware to be able to express that. But I've seen it in kids, and it's really, really common too when you see older adults start aging, and they have something called dysphagia, where they're not able to swallow as well. And so what happens is we start putting them on more pureed diets. So we take their crunchy diet, regular diet, then we go say, okay, we're going to chop it up. Then we see how they do. They maybe aspirate, get a little bit in their lungs, and we say, we need to like grind it up fine, like ground meat status. Everything is kind of the consistency of like a risotto or ground beef. And then you look at it, and then, maybe they still aspirate again. And then you go to purees. And so you're doing mashed potatoes, you're doing baby food style chicken, baby food style peas. And I see the decline once we go from there, because even the minimal texture, and even if it's, I'm going to describe it probably as goopy or, you know, whatever it is, in that texture, there still is a little bit of sustenance, a little bit of like being able to roll it around your mouth. That puree, going back to that baby food puree, which is funny because we usually start out our lives on this and then ending our lives on this, is, you know, this loss of independence, this loss of joy. You see this loss of enjoyment around mealtime. You see a disinterest in wanting to have social mealtime because you see shame and that I can't even eat regular food. You see embarrassment that I'm eating this, you know, pureed stuff. And I think of people too that are willingly, you know, shakes and smoothies, shakes, smoothies, all of this stuff constantly. And I see that and they're like, well, I can do this 30-day all shake liquid diet and I'll blah, blah, blah. And then I like always wonder, you know, had you even done it longer? I'm like, I'm impressed they can make it to 30 days. If they can, you know, if they can make it even longer, I'm like, at what point are you missing that? And they might not even be able to like cognitively like aware and say, I miss that crunch. The first person I actually heard talk about this kind of stuff was actually my mom, which is really interesting because my mom is a chronic dieter, on and off Weight Watchers. Amazing, wonderful woman, love her to pieces. I learned about dieting and I learned about body image through my mom, and she means well. And I'm helping her out on the intuitive eating train, slowly but surely. I just love that she's willing to even look at something new. But in that sense, the first thing that she told me is she said I could never do, you know, those shakes or anything like that because that crunch was always an indication of me eating and of me getting satisfaction and of me feeling fulfilled. Actually, that satisfaction factor of intuitive eating, that crunch is literally that like click of like, okay, I'm going to have a satisfaction here. Whether it is a satisfaction that we're really wanting, that emotional satisfaction or physical satisfaction, whatever it is that we're needing, we can at least maybe need a physical satisfaction. It might not be the emotional satisfaction that we're wanting. You know, sometimes we nourish ourselves and, you know, we're in a hurry or we're grabbing something. We're like, okay, I literally just need to nourish myself. You know, that's the beauty of intuitive eating, is that you're able to distinguish those moments and kind of work through those moments where you're like, this meal wasn't amazing. It wasn't Michelin star. It wasn't plated. It's not a beautiful creation. However, it is something that is going to provide me nutrition and nourishment and will last me to the next meal.
Right.
You know, and so it was interesting that my mom, even in her dieting phases,
She
was
noticed.
able to recognize that crunch is really interesting. And so I love that paragraph, probably because I have a lot of evidence-based background. So I like seeing, you know, studies and things like that, because sometimes we have physical sensations in our bodies that we can name, we can talk about. But sometimes people are able to say, well, that's just you. Maybe you just need a crunch. What about me? I can have shakes all day. But when we start inserting things like science, where we're looking at groups of people, groups of rats, groups of things, we're able to say, look, actually, this large majority of people, whether they recognize it or not, actually value this sensation, value this part of eating.
Right. Oh, yes. So good. All of it. It's so good. I think the reason why chewing is so important is because it is what delineates, is that the right word to use, the difference between eating versus drinking, right? Yes. And what a privilege it actually is. We don't even think about it. We don't even think about it. And I love how you pointed out like babies versus the elderly and how it's like a loss. Even as babies, like they're wanting to mimic, you know, the people who are chewing. So they're like, yeah, I want that, right? And then when that's taken away from you, so I find it it's interesting, and it's sad too that people would choose into that in the name of like weight loss or health, right? And not realizing that they're giving up a pleasurable experience or just an experience in and of itself that's really an integral part of eating, and that is to chew. And you know, and we didn't even talk about like, you know, his opinions on how it's an outlet for aggression, or how it's a metaphor in, you know, it's a metaphor for like life. Like, are you going through life so fast that you're just kind of like gulping stuff down, or are you actually taking the time to chew? You know, I remember I wrote a paper, this is in college, and I wrote about digestion, but it was all about mastication. Like digestion starts here. And you know, and if you're trying to like skip this step metaphorically, or if we want to like create an analogy here, then is that showing up elsewhere in your life where you're like, I can't deal with this right now. I'm just gonna like just pump it to my veins. You know, we say that as a joke, just hook me up, right? It's like, but you're missing out on so much. And so I love, he talks about how it affects our mood and just our experience of eating, and that it is this learned process. And again, how sad but fascinating it is that we subject ourselves to unlearn it in the name of what? You know, that important, because chewing is important.
I know. Oh my gosh, you made me think of a few things. It was interesting when he first talked about as a natural outlet for aggression. I actually I'd never thought about it that way, and I actually was quite like almost defensive. Like like in my head, I was almost like, well, I find it to be more of an outlet for pleasure. So I was kind of like, whoa, that's like a very, so, and he's comparing, you know, animals. So, and you know,
the idea of like biting out of,
but it was that concept I had never even thought of, you know. But then the one thing that I actually do have, something that I wanted to kind of bring up with you, where I was talking about the very end, where he was saying chewing is a pace setter. So the number of times we chew. Okay. I have seen this in diet culture where you're like 25 to 30 times or something like that before you swallow. Okay. I have some things to say about that, because
okay, let's hear it.
Sometimes, depending on the food, 25 to 30 times is like, I'm still rolling this around in my mouth. I'm like, I don't even want to feel this texture again and again and again, another 25 times. You know, sometimes I'm like 10 times, 10 to 12, 15 times is like enough. 25 to 30 times as a stalling.
Did you actually say 25 to 30 times?
No,
or that's just what you've heard?
That's what I've heard via diet culture.
Okay, yes, I have heard that too. Okay, and I was just like, did he say that?
Yeah. And I've heard it via diet culture, and in that sense, it's a stalling, at that point, it's a stalling technique in my mind. It's a stalling technique in prolonging your experience with that food, prolonging you actually consuming the energy needed, prolonging the pleasure. And you're almost, in my mind, you're almost taking it from pleasurable to unpleasurable in an attempt to not consume as much.
Right.
And at that point, it's almost like a punishment to me. You know? I mean, like certain textures. So, for example, the one thing I can think of is like soggy cereal. Like that is something that like I am like a crunchy cereal person. So like the people who like to pour their milk on and let it sit, I am like, I respect you, but I don't understand.
Yeah.
I just don't understand. Like I'm like, I want it to almost be like nuts and bolts in my mouth. I want
You like the bite. You like to chew. Right.
the bite. And so I've found cereal is actually a hard thing for me to eat because I eat it so quickly because I don't want it to be soggy. And so I've like even ratioed like, or found the right ratio of milk to cereal where I like have like a little bit of milk and I like splash the milk like onto my, and it's like so that I'm not getting that soggy cereal. So for me, if I'm chewing cereal that is already slightly soggy 25 to 30 times, to me that is a punishment. Not everyone would agree with that though, which is the beauty of intuitive eating. There are some people who really enjoy that texture, really love that texture, and that is pleasurable to them. But with intuitive eating, we can decipher that. We can say, look, my cereal I like with a little bit of milk, a lot of crunch. You like it, a lot of milk, not as much crunch. With diet culture, we're punishing ourselves either way. With either preference of cereal, we're getting it to a point where we're going, okay, we're chewing it 25 to 30 times. So that was the only thing that I mentioned is it was like, there's that fine line in which you really can take something too far.
Right. Yes, you're right. And I'm glad you brought that up too. It's funny because I use that like counter bites, right?
Yeah.
Depending on the person, right? So like, for example, my 7-year-old is like a gulper, right?
Yeah.
And to the point, it's gotten pretty bad lately. I actually should probably just have this conversation with you privately, but where he's like, he's literally gulping his food that I'm like, I really honestly do question amount wise, like, is that good for him? Like that's going to hurt his stomach kind of a thing, right?
Yeah.
So, but you're right in that there's moderation here, not to the extent of like, can we twist moderation so that we can, restrict? That's not what I'm saying.
Yeah.
But it's taking it to an extreme. And so if you have a hard time, like if you eat too fast and consequently your stomach hurts a lot because it's not being properly chewed and it's too big as pieces in your stomach to digest.
Yes.
Or if you're like gulping air as you like, there are reasons why you might want to consider eating slower,
pacing,
more bites, smaller bites, chewing. Like there are reasons, but if you're a normal eater and you chew normally, then I think it goes back to the whole like, what is the motivation behind it? And I'm a huge advocate of mindful eating because it's an awareness practice.
Absolutely.
Not as a tool to lose weight, right?
Absolutely.
So in fact, maybe this is what we'll do with your food.
Yeah, this actually was a good one.
The idea behind like chewing your food, for example, is just an opportunity or an invitation to be present with the food in your mouth, right? So you can say, oh, now it's missing no texture, I'm ready to swallow it. Or I had no idea it took this many bites to chew this thing. How interesting. So but if you're using it in a way of like, oh, well, maybe I'll expend more calories by chewing so that I can kind of like make up for, no, that's, and that's not what we're saying. But I do think it's interesting, the idea, I keep saying interesting. Well, it is, it's all interesting. But the idea of chewing as a form of aggression, I would love to ponder on that personally, maybe in our own time. But the idea of maybe that's the allure of what diet culture calls emotional eating or overeating, right? Is needing that physical outlet. And maybe it is found in the chewing, so again, this is really, it totally depends on the body and the person. Maybe you're gulping food. Why? Maybe you're chewing a lot of food. Why? And what do you need to do? What do you want to play with your food so that you can experience a range of emotions, including anger or pleasure? What do you need more of? And are you kind of denying your eating experience, which is reflective of denying like other emotional experiences, right?
Oh my gosh. So, You nailed that one, because there even in this chapter and even within this book, there are nuances, right? Between all the stuff, you can debate it on either end, right? Because my experience with that end with the pace setting, that almost triggered to me where I was like, no, that brings me back to diet culture. I almost want to like,
right. So you like,
but for someone else,
have you do it.
exactly. For someone else, like what you said, for example, someone who is gulping their food, like what he mentions on 156, where they're failing to chew it, you're actually increasing your stomach acid, possibly even increasing the risk for ulcers. This is why we don't want charlatans, diet culture charlatans, just claiming any one thing works for any one person, and that this worked for me, so it has to work for you.
Right.
And I know that it's even hard to hear that even within the intuitive eating and diet culture phase, because sometimes you hear them say like, intuitive eating works for me, so it's going to immediately work for you. And you know what? There might be parts of intuitive eating that you might really have to work on, or you might have to omit. There might be parts with, health at every size and mindful eating where it's like, that just doesn't apply to me. You look at people who do have tube feedings, or who maybe tube feed part of their foods and are able to eat parts of their foods other times. You have people who maybe have type 1 diabetes where they're like, I have to override how full I am because I have to treat my blood sugar. And in that sense, what I love about intuitive eating and what I like to bring to focus is that there is the gentle nutrition aspect, where you really do get to individualize it as a human, as a person, as your own life. And that's where I like to kind of say, when I say intuitive eating can be something achievable, or that there are glimpses of wins within your own food relationship, that's why I almost like to mimic it towards your food relationship versus just intuitive eating. Because at the end of the day, your food relationship is the most important thing, whether you're doing intuitive eating or not. And what I mentioned, mentioning with, for example, like someone, gulping the food, what you're talking about with kind of coaching your kid through that, and kind of pacing it, maybe like, 1, 2, whatever it is, the spoonfuls, whatever it is, where you're almost like, okay, I know they're going to gulp the food, so maybe I actually give them the smaller spoon. And it's like, maybe I do this different bowl, maybe I do that kind of stuff too. And you're like, sometimes as a parent, and for me, from the lens with intuitive eating, you're like, am I restricting them by giving them the smaller spoon?
Yeah.
You're like, am I restricting them by giving the smaller spoon and the smaller cup? And I'm restricting them by only letting them give water at this point. What he mentions at the beginning of this book that I want to always bring back to, and I think it's in the introduction, it is one of the first things I read, and if I can't find it, I'm just going to say it.
Paraphrase it.
Okay. Literally the introduction, I think the third page. Unlike animals who feed, human beings eat.
Yeah.
And that's what it comes down to always.
Yep.
With kids, we are teaching them how to eat. So the rules get a little bit bent from how we are, where we are as adults who have been eating more consciously our adult lives, our child, like we're becoming more conscious of our eating habits as a child into adulthood. And so with kids, you are kind of bending things where you're like, you want to be mindful of like, am I restricting them if I'm giving them this? But you also have to say, okay, well, when we had that experience that one time where they choked, or they coughed, or they vomited, that wasn't a pleasurable experience. And sometimes kids are too young to remember those experiences. There are kind of some ages where that aversion towards certain foods or certain food experiences hasn't quite come together yet. For example, I like to think of when you're starting solids with a kid, 6 months to a year and a half, 2 years, they might overeat and or burp and or spit up or something. And there's not that aversion. What's funny is they'll keep eating, unless they're sick, unless, they actually kind of have an illness, they'll usually keep eating. Or that you might kind of wait a little bit, calm down, the next feed they'll eat, versus once you get older, you have some of these aversions, you have some of these experiences. It's like some people will literally like pull away. They'll be like, I can't eat for a day. You know, there's some times when I'm sick and I'm like, it's lucky if I get fluids.
Right.
So with kids, we're teaching them how to eat, and we're teaching them, you know, we're teaching them kind of as an individual. And sometimes we have to make modifications via things like with gentle nutrition, where we're modifying the environment and we're mindful of whether or not we're restrictive. And that is the most important part, is if we're thinking and being mindful of it. Usually I find when it's the people who are not as mindful of, am I restricting? It's the people who are just skipping ahead and saying, I don't want them to do this. I don't want them to be like that. I don't want them to overeat. I don't want them to feel like that. Usually those actions will overcompensate, and there might be kind of an overstepping of the roles I like to play between parent and child in their food relationship, because you're almost trying to do it for them. You're trying to almost do the eating for them.
You can't eat for them. Like you
can't eat for them.
Yeah.
And it's that switch between allowing your child to eat versus getting them to eat, right? Like if we're only focusing on getting them to eat, I must get them to eat something, versus just allowing them to say, you know what, they are their own human. They have their own preferences. This might be a weird phase where all of the food goes in all at once and we're choking it down, and it's painful to watch and it's painful for them. And I can modify their environment. I can coach them through it. I can pace things out. I can chew, swallow, play calming music, do games, things like that. And that's really all I can do. Yeah. And there are going to be moments where you're like, I want so much more. And you can work with professional. There might be some more individualized things that you can work on that are specific, but there is a little bit of that sense as a parent or caretaker teaching how to eat. That is really all you can do. And there's a part at which you kind of have to say, okay, they are intuitive eaters. There will be differences in how that look. There will be differences in how that ends up. There will be people doing it differently than what my idea of intuitive eating is like. So I think what I really liked about the book is that he started that with animals feed. They're feeding for nourishment. They're feeding for survival. We do feed for nourishment and for survival, for first and foremost. Once our basic needs are met, once we have our safety, our, water and our food needs consistently, adequately met on a consistent basis, that is when we start eating. So if we're always privileged enough to be able to be in that just eating phase, that's what we're working on.
Yeah. Yes, I'm so glad you brought that up, and the difference between feeding and eating, because there's that phrase that it's like, oh, food is fuel, and you're like, okay, that's helpful to a point. In fact, like if it needs to help, it's helpful if that is creating some food neutrality for you, or kind of like what we were talking about earlier, right? Like 1,200 calories is 1,200 calories. Like it just, food is food kind of a thing, right? And you need it. Like you have to have energy in. But food is also so much more. And as humans and as adults and, children, as they continue to grow and develop, they get to shift from feeding to eating continually. Like it's not just like, I'm only an eater. Well, no, I feed and I eat. And it's each day is going to look different. Person, each eater is going to look different. And so I think it just goes back to that idea of where are you at? What are you needing? Especially when it comes to your relationship with food, and do you need to revisit one more than the other? And maybe like chewing can help you kind of establish those boundaries or those experiences for you.
Yeah. And sometimes people almost have to go back from, if they've been almost like on a liquid diet, they almost have to reintroduce the concept of chewing, because sometimes the concept of chewing is a physical reminder of eating, a physical reminder of energy, of calories going in. And sometimes, you know, if we're steeped in diet culture or in an eating disorder or in disordered eating, the concept of chewing can be scary.
Right.
It's a reminder that there's food in your mouth about to go into your mouth. You know, there's even those, I don't even want to perpetuate the diet culture that goes on, but you know, there's people who chew and spit.
Yeah, that's true. I'd forgotten about that.
You know, I mean, it's like, anyway.
Yeah, I know.
But
There's,
you know, throughout the process, you know, as providers and practitioners, you know, honoring the individual is where it starts with whatever their food relationship looks like, because it's going to be different for everyone, and you're going to come across different barriers every time. And you might be talking, I might be talking, and they're like, this does not apply to me. It applies to, I'm on the opposite end. I hate the idea of chewing. I actually want to go back to liquid stuff. Or someone else is saying, I've been on liquids too long, I want to go back to chewing.
right.
It is individual. That's what makes nutrition complicated.
Exactly.
Eating and intuitive eating and food relationships. It's complicated.
Yeah, exactly. It's funny. It's paradoxical in how simple it can be and how complex it actually is, or how hard you can make it. I mean, but yes, it's going to be different for every eater, and that's okay. It's supposed to be.
It's supposed to
be. That's what I do love about intuitive eating. It's not about, it's, you know, everyone else and what they're doing. It's about what you need. And I think as caregivers, I think that's where the motivation is how can I support them to develop this relationship? Not how can I control it, but how can I support them so they can develop this trust? And I need to trust this process. I need to trust them that they're able to trust themselves. And that's hard and scary to do.
Totally.
And we don't even have time to get into it. This like brings up the whole like division of responsibility. And it's just good. It's, you know, such a small chapter. It's like we could talk about this forever. So
you could talk about so much, and it even relates back to earlier in the book where he talks about perfectionism and sameness.
Oh yeah,
you know, all that stuff. Yeah. So I'm sure you covered all that.
I know. It's so good. Okay, so tell us about the food that you brought. Let's start experiencing some food before we.
So I'm actually at a friend's house. So this is a quick grab, but I do actually enjoy these. These are Triscuits, and they're the thin ones.
Oh.
But I don't like them necessarily for their caloric needs or anything else. I actually just like the saltiness and the crunch, and I like that they're like a solid cracker that like if you want like it as like a vehicle for something. So I'm a big proportion of like vehicles and like food kind of stacking and things. So I like things that are shapes that are sturdy that you can like play with kids, stack. And then you know, you can spread something on it and put something else on it and put something else in.
Oh, that would be really fun.
This is my food of choice.
That is your food of choice. Well, that's what you had, and that's okay.
Yeah.
We are flexible. That's what makes us human. Awesome. Okay, so I'm trying to like intuit what would be helpful here. What would be cool to try? Okay, let's try a couple of different things. Okay, so are these the Triscuits that are like, are they flaky?
They're pretty flaky. Yeah.
Okay.
Like if I broke them apart.
Yeah.
Like
okay. Break a piece off, and then I want you to like shred it up as much as you can with your fingers.
Okay.
Your poor friend, she's like, what are all these crumbs on my table?
Oh, no, it's fine. Okay.
So just
I'm excited to see where this goes, because I feel like I have a story like you even already.
So break it up into tiny pieces, as tiny as you can.
Okay.
And then
cribbling.
And then eat that. Whether maybe you have to like lick your finger and like pick it up.
Yeah.
Or, I don't know.
I have it on a napkin.
Yes.
I'm gonna
You dump it in your hand and put it in your mouth.
Yeah. Okay.
All right. All right. Finish the eating process there. So there's one.
Okay.
Okay. Okay, the next one is your favorite. Take a small nibble and then like chew it as long as you possibly can. Just take a small nibble, but like count your bites until it's a liquid and you're like, I can't stand it anymore.
Okay, I'm gonna stop. It's still here. I'm at 10 bites. It's not quite liquid, but
You're like, I'm done. This is your threshold.
This is where I'm like,
Okay.
okay, I made it to 15.
Okay, go ahead.
Okay.
Okay. All right, and then with the bigger cracker or whatever you have left, go ahead and take a bite and just chew it as normal, as you would normally. Ooh, you can actually hear the crunch. That's really cool.
I know.
No, I love it. It's perfect.
Some people don't always like that.
I do. It's fine. Okay, so 3 different eating styles, 3 different eating experiences, right?
Yeah.
What was it like? What was your preference? And what came up for you emotionally or mental wise as you tried the different types?
You know what? Because I do enjoy these crackers. And like in high school, one of my snacks is I would make almost like a little pizza out of them. So I would put like, my mom always had fresh basil. So I would take like a tomato sauce or pizza sauce or something, or marinara sauce, put it on cheese and like fresh basil and fresh tomatoes from my mom's garden. And I would like make little pizzas out of them. So it reminds me, like the bigger one kind of reminds me of that, like taking a big crunch, and I was missing that like additional topping that I used to have. The one where I like pureed it, experience number 2, it like reminds me of that soggy cereal. Like it just, except for a salty version, wasn't a bad experience. It's for some reason it triggered something in it, and it almost brought a vision, and it almost brought a vision of what it would look like if I had like
spit it out
at that
spit it out and give it to a baby.
And it and that for some reason was what happened. It like elicited a vision for me, and it was it's not my favorite.
Not appetizing. Okay.
Then the first one reminds me still again of when I was in high school making those little pizza Triscuits. But when I love Triscuits so much that I would get to the end of the bag and I would like get the salty bits, and just like a mouthful of this like salty crunchy bit. And I usually liked that one the best because it was the saltiest and the crunchiest, and it was like the last little bits, sometimes even the little crispy ends. It's really good.
Cool. Thank you. I love this experience because or this topic because, and we're wrapping up, so don't worry. But the idea behind like it's not just fuel. Again, it's not just this like IV or like food is important in its texture and its flavor and its smell, like engaging your body in this entire process makes it that much more satisfying, that much more pleasurable, that much more like connecting, grounding, kind of like going back to what we were talking about earlier. And that is why I love mindful or experiential eating, is because it gets you back into your body.
Yeah.
And that is, it's sad. It seems like there's a disconnect from your body, and that's what has happened in this relationship with food. And so
Yeah.
you can get back into your body and notice like what is uncomfortable and what is enjoyable, and learn again as if you were a child of what you do want, what you do like, what does support you, what doesn't. And just, it's like dating your food again, right? It's learning about yourself again. And that's the beautiful process of it. And it's just sad and frustrating that because of diet or wellness culture, we are robbing ourselves of that kind of relationship because we're stripping it of the experience itself.
Mm-hmm. I love what you mentioned about that, and it almost brings experiential eating to the most individual level.
Oh yeah.
Because no one else can feel the sensations that you feel or have the emotions elicited that person feels. I mean, you probably didn't have a vision of
Nope.
smushy Triscuits when you eat Triscuits, but for me, that's what happened. So I love that, and I'm actually, I might start incorporating some of that stuff into my practice because it's very it is the part that is missing, and it's a part where it's so individual and it's so subjective to the person. You can't say, someone, you can't, like, it almost means like blanket statements just don't always apply.
No.
And it really makes it almost makes practitioners work a little harder, which is
Oh yeah.
in a good way. Makes you work a little harder.
Yeah.
To start making these recommendations and individualized approaches, which I love. It's really good.
Yes. No, you're exactly right. It's so fascinating, interesting, my word of the day, when, I'll have someone like, hey, why don't you smell each bite? And some people are like, oh my gosh, I loved it. And some people are like, I hated it. And it's like, great. That's fine. There's no right or wrong way to experience food, but just please experience it.
I know we're probably going to wrap up soon, but you have to watch The Final Table on Netflix.
I'm going to.
And part of the reason why I liked it is because it was, from what I viewed of it, it was fairly free of diet culture. For some people maybe struggling with the image of food, it might be a little bit triggering. But what was so cool is seeing the chef's full sensory experience, not only from picking the ingredients to cooking the ingredients to plating the ingredients to presenting the ingredients, then to the other person like eating it, and it was a full sensory experience. I mean, they're literally like bringing it to their nose, like like smelling, and they're like tasting it, and they're swirling it in their plate, and it was like, almost watching that show was so cool because they went through a bunch of different countries, and the food there, and it was the words they used to describe food. I'm going to start implementing them because it was like, that's awesome. Why aren't we talking about food as an idea or as a beautiful work of art?
Yeah.
And not every food has to be like that, but there are some times where you make something or someone makes something for you and you're like, that was amazing. And we don't always have the language to say it's amazing, it's really good. Like, that was a work of art. That was that was creative. That was a good idea. So I feel like you'll enjoy that.
Oh, I will. I'm gonna check it out. I love that. And it's interesting. I swear, I need to like pull out a thesaurus. Oh my gosh, I'm gonna blame it on I'm hungry. I need to go eat. But what's really cool is, as you're talking about, because I haven't seen it, right? But I love cooking. I love all parts and pieces of food. It's probably what has saved me from developing a full-blown eating disorder. So I'm really grateful for that. But some people don't, and that's okay.
Yeah.
But just in listening to you talk about this show, I'm thinking about it, and I almost, what is the word? It was almost like, if I was to watch that, simply just because from listening to you, it's like that was an intimate experience that they were having, and they were letting you watch. And it's funny how sometimes my husband will tease me, like if I'm cooking or if I'm eating, he's like, am I interrupting something? But to me, I'm like, it should be that way. We're not robots, and again, depending on where you're at, and if you're not there, that's okay too. You don't have to get down on yourself because you don't have this beautiful intimate relationship with food, but But if you want that, what's preventing you from having it, you know?
Yeah. And and it can be with whatever foods you have, right?
Yes.
It doesn't have
Also.
to be
Mhm.
this, amazing Michelin star meal or this amazing meal that you're cooking. You could even be like that with, you know, um, a boxed dinner,
Yeah.
and
Have
like
some frozen
and
food.
like
All
frozen,
foods fit. Yeah.
and you're like, you know what? Today I added something else into it, or a little bit of this, or a little bit of cheese, or a little bit of herbs or something that like, and just like take that little bit in, and it can be almost a form of self-care,
Yes.
elevating
Absolutely.
elevating your dishes in a way that is accessible to you,
Mhm.
um, that is available to you, even if it's like for me in college, I wasn't eating fancy at all, but I had like a plate that I liked. And
Mhm.
even when I was like steeped in diet culture, like even when I was in that, I still had some essences of intuitive eating and some experiential eating that I
Mhm.
really enjoyed. And it was like I had like a mug that I like loved to drink my like warm drinks out of, and I had like a plate that like I always preferred. And like even if it was dirty, even if I like ate on it an hour ago, I would wash that plate, and that would be like the plate I loved to eat off of.
Mhm.
Um, it could be something simple like that, like
Yep.
even
Yep.
glassware, utensils, where I was like, shapeware, like I love the shape of this glass. It makes me drink more liquids, more water.
Yeah.
Um, it can be something
Exactly.
like that. Yeah.
Exactly. Yeah, so often that's what's missing. And so how can we bring that back in? Or how can you, whoever ends up watching and listening, how can
Yeah.
you bring that back in so you can foster that relationship with your food if that's what you're wanting, if that's what you're missing. So, well, thank you, Leah, so much. I'm
Yeah.
sure talk about this all day. So it's been so fun talking with you. So thank you. And I'm going to encourage anyone who's having any questions about anything we've talked about, or like that division of responsibility, or they're
Yes.
needing some extra guidance and support with their children or whatever, please check out Leah. And just thank you so much for spending time talking about food with me. It's
Yeah, absolutely.
Thank you. Thank you.
Yeah, I've really enjoyed it.
All right. I would love to hear if anyone else tried this eating experience, what comes up for you and how it's different or similar than what Leah has experienced, because it probably is going to be different, which is okay. That's great. And I want to hear about it. So, all right, we're going to hop off, and thank you.